Thanks for joining us for today's webinar. We are here today to talk about the AmeriCorps program. The webinar today, as you just heard, it is being recorded, and so the link to the recording will be posted not only on our website, but Caleb will also send it out in an email following the completion of today's session. This webinar, of course, is part of the Delta Region Community Health Systems Development Program. I'm Kate Stenyam. I've had the pleasure of meeting, I think, pretty much all of you that are on today. I am the Outreach and Education Manager here at the National Rural Health Resource Center. I have just a couple of housekeeping pieces before we get started. So, of course, your audio, like always, is muted by default when you join, and that really helps us just avoid background noise and any feedback. So we ask that you please remain muted unless you have a question or comment, and we always welcome any questions or comments. So to unmute your line, you can select the microphone icon in the lower left corner of your screen. And if you dialed in, you press *6 to unmute your line. You, of course, as always, can communicate through that lovely little chat box, which is located on the bottom ribbon of your screen. And if you haven't, speaking of the chat box, so if you haven't done so already, please take just a quick second to put your name, your title, and your organization in that chat box. It just gives us a good feel so that we know everybody who's joining us today. Thanks, Caleb. The National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. And the center is the technical assistance provider for the Delta program. The Delta program is funded by the Federal Office of Rural Health Policy, and that is in collaboration with the Delta Regional Authority. Here at the National Rural Health Resource Center, we are committed to diversity, equity, inclusion, and anti-racism, and building a culture where difference is truly valued. You can learn more about our commitment on our website or by reaching out to any one of our wonderful staff. Now, we have some upcoming webinars that I just wanted to take a quick second to make sure everybody knew what was coming up. So June 20th, we have a clinic webinar series, and the first one is Clinic Emergency Preparedness. And that will be with a speaker from Forbes, Steve Smith, who you all know. On June 27th, we have Maintaining Compliance in Your Rural Health Clinic. And then coming up in July, we're very excited to offer a two-part series on social media. And it's really the tips and tricks of how to effectively, efficiently use social media within your rural healthcare organization. And we have two great speakers joining us for both of those, and they're both from the Texas Hospital Association. So those will take place on July 9th and July 16th. So now I'd like to introduce today's session. The session today is going to provide an overview of AmeriCorps, which is the only federal agency dedicated to national service and volunteerism. Our speaker today, Tamika Eatman, will provide information on the benefits of partnering with AmeriCorps and the different streams of service, including she will provide insight into ways that you can bring young adults age 18 to 26 in to support your rural communities and utilize AmeriCorps teams to meet your goals of addressing needs targeting public health initiatives. Of course, you'll be able to ask any questions along the way, or we also will have a Q&A at the end. If you want to hold your question until the end, you can do that as well. Before I introduce today's speaker, I'm going to have Caleb pull up a pre-polling couple questions. If you could quickly just take about 30 seconds to fill out those pre-polling questions, we greatly appreciate it. It really helps us with our Delta program evaluation, having those pre and post results. So Tamika Eatman is Assistant Program Director at the AmeriCorps National Civilian Community Corps, and that is with the Southern Region campus located in Vicksburg, Mississippi. Serving with the agency for 9 years, Tamika develops projects, provides grant application assistance throughout the states of Mississippi, Alabama, Louisiana, and Tennessee. As the Assistant Program Director, she supports NCCC members, staff, and external partners in the planning, development, and coordination of projects, helping to identify needed resources, timelines, and metrics for success. She, of course, is a proud AmeriCorps alum, and she attributes her service year as an AmeriCorps Promise Fellow to a career dedicated to service, youth development, project planning, and training. So thank you, Tamika, so much for being here, and I'm going to turn it over to you to take the floor.
Thank you, Kate. Well, glad to be back here with you all and to share some information about AmeriCorps, and just talk about in general what all programs we have, but kind of to hone in on NCCC, which I represent and serve and work with currently. So let's go ahead and get started with our first slide here. All right. So to give you kind of an overview with AmeriCorps, it is a big umbrella of programs. And so we have kind of two big main branches that you want to think about how you kind of divide AmeriCorps. We have our AmeriCorps programs, but then also we have AmeriCorps seniors. And with AmeriCorps seniors, we have three different programs. We have our RSVP program, our Senior Companions program, and our Foster Grandparents program. And all of these programs work with or serve youth volunteers that are 55 and plus. And so I think too, when you're thinking about health focus, probably the two programs that would probably be of most interest would probably be the RSVP or the Senior Companions program. And so our foster grandparents program is a program that works directly with our volunteers go and support young kids that are working with special needs and things of that nature, tutoring and offering assistance that way. But the RSVP program does a wide range of different things, and it's just a big umbrella. And so there's all different types of programs and volunteer programs that can fall within RSVP, depending on the volunteer's experience and what that program focuses on. With Senior Companions, that program specifically places volunteers to serve with other seniors. And so they're thinking about ways that they can either deliver medicine or sit with them or help them get to doctor's appointments, things of that nature. So Senior Companions might be a really great option for some of you as well. And so with AmeriCorps, we have kind of those three main programs: NCCC, National Civilian Community Corps, Vista, and State National. And so with NCCC, I'll spend more time talking about our traditional program, but you'll see that there's two other programs that we also work with that we have our FEMA Corps program, where our members serve directly with FEMA, helping with mitigation and all types of things in times of disaster. And then we also have another program, our Forest Corps. And so they work directly with the National Forest Service and different forests doing burns and different things in response and all of that good stuff. So those are kind of so to give you kind of a overview of what our different programs look like, we have those two, but I'll spend more time talking about the traditional program as we kind of get into the presentation. All right, let's go to the next slide and let's talk a little bit more about what these three different AmeriCorps programs look like. We are excited because this is our 30th anniversary. So AmeriCorps has been around for 30 years. And with that, we have kind of these three programs: Volunteers in Service to America, which some of you may be familiar with, Vista. And that program did exist before AmeriCorps, but it fell within the AmeriCorps umbrella once we were established 30 years ago. And so it is a poverty-focused program, and they focus on capacity building. So when you think about, do I need help with volunteer recruitment? Do I need help with starting a new program? All the different things that can help build capacity for your hospital or for health centers and things of that nature, then that's what you want to focus on. It is a year-round program, so you have a volunteer serving with you 365 days a year. And it's kind of when you think about that individual that helps to help support your program in different ways. The Volunteers in Service to America, Vista does not do any direct service. They do the indirect service. With our State National program, it also gives the option of year-round. It is our largest AmeriCorps program, and a lot of times I'll talk a little bit more, but there's several different focus areas and it's kind of similar when you think about RSVP and our State National program. The focus areas are a wide variety of different things that they can focus in on in that type of program. I will say we have our Public Health AmeriCorps program, which falls within the state and national category. And just to give you an example, a lot of the states have a program that's called Heart Corps with the American Heart Association. And this corps is basically focused on doing things like uh, blood pressure screenings and helping to kind of core educational programs. But it's actually it is a state or national direct program under that umbrella. So we actually have programs that really focus in on health, and different states have different programs depending on what the needs are. And so I encourage you to kind of look at those different programs and find out more about it. And I'll tell you a little bit more how to do that as we go through. And then, of course, our National Civilian Community Corps, NCCC. And so NCCC is a team-based program. Our members travel around in 15 passenger vans, you can expect around 10 to 12 folks on the team. They come in and they do short-term, high-impact projects. And so they're there for a short period of time. You can think about maybe 3 weeks at a minimum, up to 10 or 12 weeks at a maximum. It is a residential program, and they come in. So it kind of gives you a view of what all different programs we have, and all of them kind of filling a different niche, you could say, in terms of what your needs may be in regards to volunteer needs. All right, let's go on to our next slide. So to give you an idea how who administers some of these programs, we have volunteer service commissions, or our state commissions. And so each state has one, except for South Dakota. All of your states have a state service commission. Some of them are, the commissioners are governor appointed. Some are state agencies, some are private nonprofits. It just kind of depends on how was set up in that state. And so they receive grant funds from AmeriCorps to run AmeriCorps programs and volunteer initiatives. And so, like I said, each state has one, and they're available to contact to kind of find out more about what type of AmeriCorps programs are available in each of your states, and can offer assistance in that way. Let's move on to the next slide. And so we also have our Office of Regional Operations under AmeriCorps. And you notice that this program administers more than 2,000 national service grants. And it's kind of the funnel through for all of our AmeriCorps programs, AmeriCorps seniors, and things of that nature. But we have 8 different regions, as you can see here. Out of the regions that you all target within the Delta region, you all fall within 4 of those regions. And so each of those kind of have a structure to, especially if you're interested in AmeriCorps seniors, if you're interested in VISTA, these would be some of the offices that you would contact to find out more about how to look for assistance. There may be, with our VISTA program, there may be intermediaries that can provide an individual volunteer service within your community. You'll just need to find out more about it if you're not necessarily interested in applying and setting up an entire VISTA program yourself. All right, so let's move on and talk a little bit more about what NCCC's structure looks like. And so we're actually divided into 4 campuses. And so I'm kind of curious, for the folks that are on the call, like looking at this map, which region do you fall into? Of course, we have our Pacific region, which I don't think anyone on the call would fall into, which is located within Sacramento, the main campus in Sacramento, California. Our Southwest campus, which is in Aurora, Colorado, and then our North Central campus, which is in Benton, Iowa. And then, of course, I represent our Southern Region campus, which is located within Vicksburg, Mississippi. And so I'm seeing Southwest and Southern here. And so within the Southern region, as Kate mentioned, I think earlier with my introduction, I cover 4 of the states out of the region, I think, that fall within your Delta region. And that includes Tennessee, Alabama, Mississippi, and Louisiana. And then we have other assistant program directors that work throughout all of these regions that do similar things that I do. All right, let's move on to the next slide. So just to give you a little bit more information about who are the people that serve in AmeriCorps NCCC, they are 18 to 26-year-olds. They come from all across the United States and territories, and just all different types of backgrounds. Recently, we've been training a little bit younger, and that but a lot of kind of about 40% are high school graduates on the younger end. The average age is 19 to 20. But then we have kind of a split between those who have college experience and those who are college graduates. And we just have a range. Some are trying to figure out exactly what their next steps will be. Some are looking at they're doing gap years. Some are getting ready to go to law school or go to medical school after they finish this program. And so, just a range of different members all across the United States in different places and the points in their lives that are interested in serving or finding out more about ways that they can learn about themselves and build leadership skills. And so, all of this, each team has, like I mentioned, about 10 folks on it. Sometimes they can be as low as 8, but the max can be 12. And they have a team leader that is with their team that is generally around their same age, maybe a little bit older, but that serves kind of as a liaison for the campus and working with the team. But they don't necessarily come in giving they're there for kind of more information and guidance, probably more of the technical and things that you need, the training wise, you're going to look for your supervisors to do that. They don't necessarily come in skilled. It's one of those things where they come in wanting to learn. And so you get a lot of energy with our members because they're at that point where they want to find out more, they want to explore, and all of those things. And so this is an opportunity for them to do that. But we're looking at our sponsors to help provide that guidance and give them the training that they need as they come along to do the work that needs to be done. All right, let's move on to the next slide. All right, so how is our year organized? So when our members sign up, they sign up for 10 months of service. Actually, for our Southern region, we'll welcome our new set of, we just actually graduated a class last week. And so we'll be looking at having our team leaders come next month. We'll welcome them in for training. And then our members will come in July for training, and then they'll go out and start serving in August. So they go from community to community, serving within our region that we just showed. And so they can be 3 weeks serving in Mississippi, and then in another 4 weeks later, they could be in Kentucky, and another 4 weeks later, they could be in another part of our region until they finish up their service in May. And so they go, like I said, from one community to the next, learning about that community, helping to meet those needs. Our areas of service fall within urban and rural development, infrastructure improvement, natural and other disasters, environmental stewardship and conservation, and energy conservation. Probably the areas that I would think that probably most of you would probably be interested in would probably fall within that umbrella of urban and rural development. A lot of our projects do, or perhaps the infrastructure improvement, especially if you're looking at any building improvements or things of that nature, then that may be some of the areas that you're looking at. But if not, then it falls within that urban and rural development category, which is one of our areas of service. All right, let's move on to the next slide. So what are examples of some of the things that our members can do? And what are some of the things that they have done in working with different hospitals? So one thing would be food prep and meal delivery. It's something that our members have done serving in hospitals. Also, when you think about screening and switchboard operation, also when you think about environmental support, our members have assisted with that. Also, maybe public facility rehabilitation. If there's things that need to be done with the building, or if you want beautification of grounds enhancements, painting, putting in, beautiful flowers to welcome folks that come into your facilities, things of that nature, murals, things of that, or event and volunteer coordination. Some of the things that we really kind of look for in involvement with communities and what that looks like if you have a big events coming on, or if you need assistance just in planning and preparation with setup. Our members come in handy in those kind of times when you need a lot of hands or you need boots on the ground to get things done. Also, when you're thinking about, oh, we need to find out more information, we need to do assessments, or we have a specific program and we really need to do more outreach, whether that means getting out information about your program, building up volunteers to support it, all of those things. Also, kind of that idea of working behind the scenes with call centers or any logistical support that you might need in times when you need assistance. Members can assist with that. One thing that I want you to think about with AmeriCorps NCCC, within that urban and rural development kind of category, we don't necessarily tell you what your needs should be. We kind of help to think about how can our members help to meet the needs that you have. So when you think about what are things that I really need done, that 10 people could come in and can help achieve and make that happen, and if I can train them to get that done, then we're looking at seeing how we can help support you in doing that. So we're not necessarily, you may not see something on this list, but you think, oh, I think 10 people really could come and make a great contribution in that way. Please follow up with us and let us know how we can help make that happen. And we'll help you think through that. That's a part of what we do as assistant program directors to kind of help you think through how to utilize and work with AmeriCorps and NCCC and work with our members to help meet your needs. All right, let's go on to our next slide. So looking at what the, kind of what you think about in terms of projects, something, doing more with less is kind of one way to kind of think about that. And so if you have had a loss of volunteers, or maybe you don't have as much staff support, or you've got something where you're restructuring, or you've had an increase in visitors, things where you need, or funding. You've had a decrease in funding, but you really use having those individuals there. Or maybe just due to all the changes that we've had over these last 4 years, you've had to defer maintenance. And things have kind of piled up at the point where, okay, we really need to have somebody come in and do those types of things. And so, this is where an NCCC team could really be of assistance when you think about, okay, we have a loss here, or we have an increase here where we really do need some support. So think about those things of that nature, and think about ways that perhaps maybe a team could be of service with you there. Right. Next slide, please. So what does this process look like? How do you apply for a team? Well, first you start off with contacting your regional campus. I saw that we have some folks that are on Southern, but then also Southwest. Like I said, in our office, there are 4 assistant program directors. So we split our region up into 4 different areas that we all kind of focus in different parts of our region. I've already mentioned kind of the 4 states that I work with. But similar to the Southern region, each of our campuses have assistant program directors that help you and assist you. And so we're here to kind of help provide you with the information you need to submit to your concept form and to get you started. So the next thing that you'll want to do is complete a concept form. And I always like to say that the concept form is kind of like a letter of intent. The 2 things that you need to think about when you're submitting your concept form, it really truly is a concept. What are the needs? Some of the things that we just talked about. What do you need done? How can you utilize these volunteers? How can you utilize our members? Is what you want to put in the concept form. So where's your need? What challenges are you facing with your need? Things of that nature. And then thinking about what do you need done and what do you want the team to do? And so those are the 2 big things that you need to have when you submit a concept. And then from there, a few weeks later, once you submit the concept form after that deadline, then our different campuses will invite you to apply. And once you receive that invitation to apply, you'll submit an application. And with an application, you do want to think more about what does it look like from day to day. What will our members be doing to help support you within that time frame that they're there? And so, looking at, specifically, what do you need to accomplish? How will you work with the team? And how will you support and train that team, or things that you'll do within that application? We do have technical calls to help support you when you prepare that application. But then once again, we as assistant program directors are readily available to kind of schedule meetings with you before the deadline for the application. We actually even do early reviews. So before that deadline, we offer a review of the application where you can submit that early. We give you feedback before the deadline. So we're there to kind of help you be successful in this application process. All right, next slide, please. So once again, how do you apply for a team? So I know someone from the Southern region, and this is what we're looking at. We've already had a concept form due in April, and we'll have the people that submitted for that turn in their full applications next week. Teams will be available to serve beginning in August, in October. So you're looking at kind of almost a 4 to 5 month, kind of time frame where you submit that concept form with just kind of your ideas on what you think the team should be doing. And then, of course, you kind of not necessarily finalize that, but have a more concrete plan by the time you submit your full application. But then also we offer, once you're awarded a team, to kind of revise your plans and things of that nature if needed before they arrive. And so looking at when our region is accepting applications, we actually have a concept form that is coming up due in July 10th. And so you would submit July 10th, and then from there, a few weeks later, you'd probably get an invite to apply, and you would apply by August the 29th of this year. Then teams would be available to serve. It's kind of a split round. They would be available to serve anytime between November the 7th through December the 19th. Our members then get a winter break, and so they'll be leaving, coming back. And so they could be back available at your site between January 8th through March 9th. Say if you needed them all the way from November 7th through March 9th, you could request that entire time. Or you could say, oh, you know what? I really kind of need them the first half, that November 7th to December 19th, or I need them back at the beginning of the year. And so you could indicate in your application which is the best time frame within that round. Even shorter periods, like, oh, I really need them just for the month of February or whatever, the end of that time. So you can be a little bit more specific in your request. I will say that we try our best to help meet that, but you have to sometimes be flexible because we're trying to make it fit for all of our different projects and programs. But you can make a request and we'll try to work with you in helping to meet that request. It may not necessarily work for your exact dates that you request, but we can try to work with you around that. And so then once again, we have a round 3 where the concept form will be due in November 20th. Also coming up for those who are representing the Southwest, they're also beginning their round 1, which will begin a little bit later than ours. Their concept form is due in June, so coming up next month. And then their round will begin November the 8th and December the 15th. And they'll have we all kind of begin at different times in the year. So you'll notice that all of our campuses kind of have different schedules, but we generally all have the same 10 months. So we have different kind of breakdowns and deadlines throughout the year. And then our North Central campus is in the process of kind of wrapping up their service year and starting a new one. So they've already had a concept form due, and they have a application coming up for June 4th. And so they'll be releasing their dates soon. But for their round 4 would begin in September. So like I said, we're all kind of in different phases throughout the year where we start our programs, kind of have some overlap. we all kind of have different deadlines. So you just want to reach out to your different campus to kind of find out what those dates are and what those deadlines are. That kind of gives you a snapshot of kind of what a program year is, how they're structured, and when you could possibly apply. I'm looking at our region and just kind of getting an idea for our other regions that are represented within your region. All right.
Tamika, can I ask a quick question?
Yes, please do.
Yeah, we have a couple of our hospitals on that are in Illinois, and so they would fall into that north central one on the bottom there. So will there be, it looks like that due date for the concept form, obviously that's already passed. Would there be other opportunities within this year for them to apply, or do they have to wait again till like next April?
So no. So each of these, they'll probably have similar to like we're in our round 3, or excuse me, we're in our round 1 phase. Within a few probably weeks, they would have, and I'm going to show also the contact for the North Central region at the end. So I actually have the individual that you could contact to reach out to kind of find out exactly. But they'll probably have their next program year starting in the fall or the winter. And so there'll be other deadlines coming up probably at the end of this year because we kind of all have these different 3 or 4 deadlines each year. And so they're wrapping up their service year with round 4, but they'll start off with another round 1 pretty soon.
Yeah, absolutely. Thank you for clarifying. I was just a little nervous reading that thing, like, oh no, I hope they didn't miss if they wanted to apply within this year. So that's great that there's multiple rounds for all of the different regions and they can reach out there. Okay, that's perfect. Thank you so much.
And it just kind of rolls around. They change a little bit each year, but they just kind of roll around the same time each year. So they're wrapping up their, 2023, 2024 program year, and their 24, 25 year will start a little bit later than ours does. Like we're all kind of on different tracks here. Yeah. All right. Next slide. Are there any other, before we move on to the next slide, or as we get ready to go to the next slide, are there any other questions? All right. So what's kind of thinking about what is your role as the sponsor when you're looking at hosting a team? Some of our AmeriCorps programs do require a cost share or, a match, but there is no charge for sponsoring an NCCC team. But we do ask you to provide some things when you're hosting an NCCC team. One would be, because we said they travel in these 15 passenger vans. So we provide, their how they get there and how they get around. But at the same time, we're asking the sponsors provide the lodging while they're staying within your community. And so when you think about lodging, they can look like a lot of different things. Some of our members are serving with, in parks, or they're serving with, there's a range of different things that our members do. They may be serving with a hospital one round, serving with another agency to prepare to taxes in another round, doing environmental trail work in another round. And throughout that time, while they're doing the trail work, they're living in tents. So when you think about lodging, it doesn't necessarily have to be anything that that is real fancy. They're there to serve. They're there to support. So if you have an open space where they can have access to the restroom, where they can have access to a kitchen, all of those things that's the main thing that they need. So safe place to sleep, and where they can shower, and then where they can eat. So that can be a big open space, maybe a big room that's available. We can send them with cots. And then, as long as they have places, sometimes the kitchen is within the same building, or maybe they have to walk across the street to access a kitchen. That's okay too. Once again, we're there to kind of work with you and think through those things. But then also, if you think, oh, wait a minute, we don't specifically have that lodging, or we don't necessarily have the place for them to stay, one thing I encourage you to do is to kind of think about, how can you partner? How can you work together? Maybe there's a couple of people that could utilize a team doing some other things. Maybe So a lot of times, a lot of churches have that type of space where they're welcoming volunteers, or summer camps. Um, you know, when you think about a partner, if it's a nonprofit, uh, then that team could be serving with maybe that summer camp one day, and they're serving with your agency 4 days to offset the cost of them kind of staying. So there's different kind of creative ways that you can think about, how do you house or lodge a team, and we're there to kind of help think through that with you. So be open, just like contact us. Let's help work with you to kind of think through that. Sometimes that means staying in the neighborhood, in the city park. We had a team stay there. There's all types of things that you can think about, when hosting a team. The other thing that you want to know that you'll need to provide are the project materials. So we're providing basically the people to help get things done. But if you say you're wanting to do some repairs, or you're wanting to provide something within your for your hospital, then you need to provide the project materials. But then also think about, once again, remember our members are the 18 to 26-year-old volunteer that's not necessarily coming in skilled. So whatever you want them to achieve while they're there, you'll need to provide the training and the orientation. And of course, we'll ask you to kind of give some information around that in the application. And then one other thing would be the supervision. But supervision doesn't necessarily have to be one individual. Maybe that's different site supervisors working in different departments to supervise a member. Out of the 40 hours of enriching service that we asked you to think about for that entire team, you want to make sure that 50% of that is supervised. So out of 40 hours, you want to have at least 20 hours of supervision. And depending on the intensity of the task, or maybe initially when you're first getting a team, you may want to have more supervision at the very beginning, kind of starting off and thinking through, okay, I need to provide supervision full time for the first couple of weeks, but then once they've got it, then I can let them kind of move on from that. Or this is a task that requires lots of, it's kind of a tedious task, and I want to make sure that there's supervision there. But then also, like I said, it doesn't have to necessarily be one individual. It could be several different folks. It could be some of your lead volunteers that you have supporting your hospitals. So there's different things looking at that as well. And then the 40 hours a week, that can be kind of how you're scheduled. So that could be 4 10-hour days, or that could be over a weekend. You just want to kind of, figure out, how am I going to build a 40-hour work week? But it doesn't necessarily have to be your Monday through Friday type of schedule. All right, next slide, please. So what we do provide with our members, we make sure that all of our members have passed the federal background check. We understand that they're working with vulnerable populations. And so we make sure that before they can be a part of our program, we do a background check. We also do some drug screening, TB tests, and things and are vaccinated before before they join the program. But then also, and then like I mentioned earlier, we have team leaders there to kind of handle concerns. They don't necessarily train them on the individual tasks. Once again, that's the supervisor or you. But then also, like, to any other concerns, or to kind of work between the sponsor, between you and the team about who's best fit for that, then you have a team leader there to help support you with that. And then, of course, we have that transportation, having them go from one place to the next. They do have health benefits, and they're covered for workers' comp. So as a part of a federal program, we make sure that they're covered for any liability. And so there's no worries there on that end. But then also, we do provide them with a minimum budget for food. And so that's one reason why they need access to a kitchen. Or if you do provide meals, you just want to, because they have a very, like, $6, a little over $6 a day, that they pull their money together and they work to prepare their meals. So that's one reason why we ask, can they please have access to a kitchen? Because they don't have big budget to go out and purchase food. They're working kind of to serve, but then also realize, like, how do you save your money? How do you live in these communities that are, similar experiences with that? So people that need to budget, but they are also challenged with that as well. We also can provide them with laundry and tolls if needed. So there's some costs that we make sure that we cover on our end, so that they're minimal on your end as well. But we just kind of look for you to take them in as a team of young adults and wanting to work with them and serve with, have them kind of learn about your field, because with them being kind of that impressionable age, some of them may be looking at going into the health field, and you never know, you may have your next employee after having, a lot of times our members, I've had several offer positions after they've had a team serve with them, and so they are trying to figure out what their next steps are. And so it's a networking opportunity for them. But then also you may see some great talent with some of our teams, and they may be a great fit to serve with you in the future, just depending on what your needs are instead of staffing and their backgrounds. All right, next slide, please. All right, so we have a couple of quotes here just to kind of give you an idea of what some of our teams have done over the past, and the impact that they've had, whether with the sponsor or the impact that it's had on our members, because we do have a dual a mission to develop leaders and strengthen communities. And so those are kind of our two focuses in AmeriCorps NCCC program. But they really can get a, first-hand experience on what it means to serve within a community or to serve within a hospital or a health organization, and understand what the needs are and the challenges are, because they're actually interested too in that. They're interested in finding out like how does this all work, and how do you do it, and what do the operations look like, and that type of thing. So I want to open it up to, before I kind of continue on, I want to once again ask, are there any questions kind of about what the requirements are for a sponsor, anything of that nature? Are there any questions there? Are there any ways that you could see utilizing AmeriCorps? If you want to add in your chat, what ways do you think you could possibly, what are some of the needs that possibly an AmeriCorps NCCC team, or maybe even some of our other AmeriCorps programs could help assist with some of your needs?
I apologize if I missed this. This is Kelly Brugan at Washington County Memorial Hospital. But what are the average length of the projects?
So the minimum length usually is, I would say, the very minimum, probably 2 weeks. We try to encourage at least 3 weeks. But let's see, Caleb, can we go back to that? Go back a few slides to where I was showing kind of our round dates. Yeah, here we go. So you could say some teams could be serving, from looking at like our first round, could serve between August the 7th through October 30th. So, basically 2 months would be the max time. But a lot of times, some sponsors maybe ask for like just half that time, or they're awarded just half that time. So they're, August through September, or September through October, or something like that, are some of the things that. So we do have a range, but I would say 6 to 8 weeks generally, but you can be as short as 3 weeks. So, and you can be as long as like 10 to 12, it just depends on what your need is and how do you utilize a team. Kelly,
yeah, I'm trying to think of different projects we have around, and so where would it fit in, like smaller projects, larger projects. And so that's why I wasn't sure, because I saw this slide And I was trying to kind of picture different size projects like within that time frame. And so that's one of the reasons why I was asking. But this is fantastic. I'm so glad we have access to a program like this.
Yeah, yeah. And then also one other thing that a lot of our partners or a lot of our sponsors do, they actually partner with other folks within their community. So say there's maybe another hospital or maybe another agency that you partner with to do community outreach, and they could utilize a team for some of the things that they do. And so it's, thinking about, okay, we have a big event coming up in October, November, whatever. And we know we need folks, but there may be a little bit of downtime in between that time. Maybe our partners really could utilize that. So, that's one way that you can think about that. Like, oh, maybe I can partner with someone during that time because they also have some needs during the time but I know that there's going to be a little bit of downtime. And I want to maximize that 40 hours of work week. I really need them in the mornings, or I really need them in the evenings. Maybe they could go to another agency. Once again, there is a lot of flexibility in how you structure the workday, how you work with other partners, and things of that nature to make it happen, to help support the needs for your hospital or for your community. And we're happy to kind of help you think through what that looks like. All right, Caleb, can we go back, kind of move on forward? All right, so as I promised, this is our breakdown of who to contact with NCCC. So once again, my name's Tamika Eatman, and the great thing is I develop projects for 4 states out of your region. So the majority of the states within your region, I develop projects for, but then also within our office, Stephanie Chan develops projects for Kentucky. For our Southwest region, we have Ka and we have Nicole that help develop projects. And then for our North Central region, Alana would be the contact. So anyone that's calling in from Illinois today, they would reach out to Alana. And I know that, Kate, these slides will be shared or be available as well.
They will be, correct.
Okay.
Yep.
Yes. So you'll be able to reach out directly to the APDs. You can also reach out to that general email, but the individual, depending on what states they develop, you can email them or contact them directly and kind of start that initial conversation about, okay, so what are the time frames that you're looking at for our region? These are some of the ideas that I have, and I want to help kind of talk through what does that look like. And that those will be the actual individuals that you would work with within our NCCC program.
Well, thank you so much, Tamika. Does anyone have any questions? Or I would love to hear from anyone on the call if you just have some ideas, even that you're like, I think that this project would work for this. If you want to put those in chat or come off mute, I think that'd be fantastic. One thing that I thought of is several of our sites have, through the community care coordination process of the program, have been working on to develop community gardens, which are a ton of manual labor, of course, and to get 10, I'm assuming very energetic young people to help out with that manual labor to get some of that up and running, that might be a great project. Or just doing grounds and facility cleanup and painting, and seems like there's a lot of opportunity here. So I was just wondering if anybody had any ideas as you were listening to Tamika about ways you could utilize this amazing program. As you're thinking, I'm going to have Kayla pull up the post polling, if you could pull that up. Everyone could fill that out for us. And I do love how, Tamika, you made a point in there too, to get these young people into your facilities, like into the rural arena, into these rural healthcare organizations. So not only do they get the ability to see these wonderful communities and all of the wonderful people there, but also get a taste of healthcare. And like you said, it might be a future employee. I mean, we'll take that any day, right?
Yes. I mean, it's such a great exchange, I think, for them to have this opportunity to be around seasoned professionals to hear their stories, to learn why they, do what they do. But then also to meet these young people that are all across from the United States and kind of what's brought them to this point in their life to do these different types of things. Maybe they haven't been exposed. I mean, that's the other thing. Like sometimes we have members that haven't been exposed to some of these other communities. And this is such a great opportunity for exposure for them. But then sometimes it's great exposure for the communities that they're serving in, because they haven't had a chance to meet these, people from all these different other places with different backgrounds. So I do think that it's just a wonderful opportunity for them to learn more about healthcare, but then also to learn about the communities that they're serving and sometimes the needs, because then either they go back, they really kind of become passionate about the work and they can learn about how can I help serve in similar communities or go back to this community to do some things because of the needs there, or how can I duplicate what's being done when I go back to my hometown.
Love that. Well, we have a quiet group. I don't see any questions or anything coming through the chat. As we noted, this was recorded. Caleb will send out the slides and the recording afterward, and all of the contact information on here is available, of course, to all of you. So if you're thinking of projects and want to reach out to your local program director, we really encourage that. But Tamika, thank you so much. Always such a joy to have you join us every year, and can't wait to see you again next year. But in the meantime, anyone in her region, please reach out to her if you have some ideas you want to run past her. We really encourage that. So with that, we'll close shop for today. And thank you so much. We hope to see you on our upcoming Rural Health Clinic webinars and our social media webinars as well.